Hi everybody. Now we're in Lifetime Management, Chapter 2, Psychosocial Health, Part 2. Now this part we're going to look at mental illness. So we're going to consider what it is and a very brief overview of mental illness. So be aware that we're going to be looking at topics on mental illness that are meant to give you an idea of the diversity of the topic. Now, I teach a 14-week course in abnormal psychology, which is much more in-depth and much more deeper view into these and other psychological disorders. And as I say to my students in that course, and I'm going to share it with you today as well as what I did at the end of the part 1, and that is to say that please do not self-diagnose or diagnose others. It's tempting, but don't do it, please. You are not a diagnostician or expert, and therefore do not know enough about the diagnostic criteria based in the DSM-5. That's the Diagnostic and Statistical Manual on Mental Disorders, 5th edition. Okay, so please bear this in mind. And this is a very brief overview. There is not enough in this particular chapter to do any diagnosing of anybody. There's no criteria that will be listed to indicate what the criteria are for diagnosis. Okay, let's move on. So mental healthy individuals value themselves and perceive reality as it is and accept their limitations and possibilities. They carry out their responsibilities, establish and maintain close relationships, pursue work that suits their talents and training, and feel a sense of fulfillment that makes the efforts of daily living worthwhile. However, what about when we consider what is mental illness? Well, it's a different story. A report on mental illness in Canada defines mental illness as categorized by alterations in thinking, mood, or behaviors associated with significant distress, dysfunctioning, and impaired functioning. Now, it's really important to consider this. When I teach abnormal psychology, we look at 5 basic conditions for abnormal behavior to be considered a problem. Basically, we are promoting the thought that for some people, the disorder is not a choice or a desire. It is a condition that influences all aspects of a person's life. Now, we know that it's got to be distressful for an individual. So when we consider some of the things that we might say without really thinking, for example, and I've heard this in classrooms and I've heard this around the school before, my OCD is kicking in. Just because you happen to like some things sort of tidy or in line. A person who is genuinely experiencing OCD is under a great deal of distress. It's not a momentary alignment issue. It is a lifelong, 24/7, 365 daily distress, dysfunctioning, and impaired functioning. As is all mental health illnesses issues that we're going to touch on, based on some of them, of course, you will be familiar with. Others, not so much. We're going to explore this mental illnesses, which will include mood disorders and all that's in an umbrella under mood disorders. We'll also look at schizophrenia, anxiety disorder, personality disorders, and eating disorders. And we're going to explore some of these now. And again, I'm going to remind you, these are just a very brief overview. So does mental health affect physical health? Well, there's a site, and it's in Canada, and it's boasting that I think it's called depression hurts. And it doesn't mean depression hurts other people or depression hurts yourself on an esoteric or sort of non-specific manner, but that physically depression hurts. Mental illness affects the mind and the body. Depression has increasingly been recognized as a serious risk for physical illness as well. Treating mental health problems leads not only to an improved health, but also lower health care costs overall in any given society. So when we think in terms of mental health, what role or roles does diversity in mental health have? Mental illness affects people in all occupations, all educational levels, and all income levels. There are some mental health issues that affect women at a higher rate than they affect men in all age groups. Young adults are also at some risk. Cultural assimilation plays a role as well. In cultural assimilation, it's what has occurred to Canadian Indigenous people. The federal government attempted, from what they believed, their own cultural norms and cultural variations, to assimilate the Indigenous into what they thought was appropriate for them. So the Canadianizing of Indigenous people, loneliness, isolation, religious rituals, suppression of their own native language, ridicule, harsh punishments, and sexual abuse experienced at some of the residential schools across Canada have been very emotionally devastating to many Indigenous children and families. The whole process of removing elements about who you are. As you remember from part 1, we talked about self-esteem, and the things of that nature could have a powerful impact on our mental health. Then, of course, compounding that, the removal of families and the disconnect occurred. It's made things much more difficult for people now in the Indigenous populations, how they gather back together in families to re-engage how families work again. There have been growing reports that people are experiencing homelessness, which include absolute homelessness, being at the risk of homelessness, or what's known as the hidden homeless. Hidden homeless is really reflective of people who you don't see, but they're still there. Now, some of these degrees of absolute homelessness and being at risk of homelessness and hidden homelessness, people who are more likely to experience mental health issues as a result. If you haven't any stabilities, and you can remember from part 1 of this chapter, Maslow's hierarchy of needs, that many people in degrees of homelessness are still at the very basic physiological level. Maybe safety level on the hierarchy of needs, and getting to the point of love and belonging isn't a part of their agenda. They're still trying to get food, shelter, the basics. Once those are addressed, there can be some degree, of mental health issues regarding the homeless. Widespread misconceptions about mental illness cause further problems. This is known as stigma. We get a lot of misconceptions in the social media, movies, newspapers, and magazine articles, blogs, and yada yada, we can go on forever. Many individuals are subject to stigma, the severe social disapproval, whether that's formal or informal, direct or indirect. It is not surprising that stigma can and does affect one's mental health and perception of acceptance. Now, here is where we will very briefly explore some of these groups of psychological disorders. So we can consider who we know or who may experience any of the following psychological disorders and how social stigma may affect them. The American Psychological Association, APA, produces the DSM-5. This is the Diagnostic Statistical Manual for Mental Disorders, the 5th edition. Hundreds of clinicians and experts contribute to the DSM in an effort to do better diagnoses and to better treat. All right, so let's begin by looking at anxiety disorder. Now, anxiety disorder is an umbrella term. It's not just one mental illness. It's an umbrella term for which others fall within. Anxiety disorders may involve an inordinate fears of certain objects or situations. These would be the ones that we would normally call phobias. Episodes of sudden, inexplicable terror. We would know these as panic attacks or panic disorder. And chronic distress. Generalized anxiety disorder, or GAD, that's generalized anxiety disorder, or experience persistent thoughts and behaviors that are disturbing, obsessive compulsive disorder, or OCD. We will start with generalized anxiety disorder, and as mentioned, it's also known as the abbreviation of GAD. It is an excessive or unrealistic apprehension that causes physical symptoms that can last, listen to this, last 6 months or longer. Some of these conditions that I will express in this chapter are just representative. Many of us will have experiences of anxiety, but perhaps for an hour, a day, maybe even a week or two. However, for someone to be diagnosed with generalized anxiety disorder, we're talking about 6 months or longer. That's a very, very small number of the population. So when we talk about our anxiety, our OCD, or our depression, we're often not representing a diagnosis. We're representing our misunderstanding of what those things mean. Many individuals do not seek treatment for their anxiety, yet most do. Even for severe and disabling problems, can improve dramatically. The stigma that can be attached to simple statements that don't appear accusatory or blaming, we might say, well, it's just anxiety. However, not everyone has been diagnosed with a debilitation anxiety that affects them every day, all the time. We all have anxiety, but the stigma attached to it can limit people's ability to go out and get the support they need. Now, next we'll touch on is phobias. Phobias are the most prevalent type of anxiety disorder. Phobias are the out of the ordinary, irrational, intense, unreasonable, and persistent fears of certain objects or situations. There are literally hundreds of different phobias. It's really about what gets developed in terms of our faulty thinking. If you think of a person's fear of dogs, it's not because all dogs are bad. It's more frequently as a result of a bad experience with a dog that have become more and more irrational in terms of its fear. That this experience with this dog this time represents all dogs all the time, that's where it becomes irrational. No medication is effective by itself in relieving phobias. The best approach is behavior therapy, which consists of gradual, systematic exposure to the feared object. It's a process known as systematic desensitization. If you're afraid of spiders, you won't start out by touching spiders. Of course, that would be very stressful. But you might look at an image of a spider and then gradually maybe be in the same room that a spider is in. And then maybe to a point where you could sit side by each with a spider on a table and not have any of these fears emerge. It's systematic, it's gradual, and it's with the fear object. Now we will consider the anxiety-based disorder known as panic disorder, where individuals who have had a panic attack describe them as the most frightening experience in their life. Shortness of breath, racing heart rate, dizziness, and some of the experiences. A panic attack disorder develops when attacks reoccur and an apprehension about them occurring at all becomes so intense that the individual cannot function normally. And that's a key. We've all perhaps had a moment where we felt some panic. However, we maybe managed our breathing or the event passed, but it dissipated. So I'm not talking about panic disorder or panic attacks. These are intense. This intensity is not something that we might experience and then sort of go, well, that was tough, and move on. No, these go on for a while and are so frightening, one is debilitated. I had a friend who had a panic attack when I was present, and it was no cakewalk for him, and it didn't just end and it was done. He was so fearful that it might happen again that more of that anxiety crept in. The fear is so extreme, you may feel like you could even die. Now, you won't die, but the experience is very powerful. There are 3 primary treatments for panic disorder. One is cognitive behavior therapy, which teaches specific coping strategies for coping with symptoms. CBT, that's the cognitive behavior therapy, and medication combined is probably the best alternative for success and a low risk of relapse, of it reoccurring. CBT would support learning breathing techniques, learning relaxation techniques so that you can reduce the panic when it's occurring. It takes practice. Now, I'm adding one here that your text has mislabeled. PTSD, post-traumatic stress disorder, does fit in anxiety. It's in the DSM-5 under anxiety, and this is where it's supposed to be. Your text has it labeled under depressive disorders. It does not belong there. Now, in post-traumatic stress disorder, also known as PTSD, individuals re-experience the terror and the helplessness that they maybe experienced at some point in the past. Now, this re-experiencing can be in the form of intrusive thoughts or in our dreams. Now, a lot of the times it gets associated with the military. However, they're not the only people who will experience PTSD. It'll be found in the firefighting industry, policing, but also people who have been victims of crimes, rape victims, or people who have experienced traumatic experiences. A variety of experiences can forever change the way in which people view themselves and the world around them. Combat, captivity, fire, floods, car accidents, witnesses of assault, sexual abuse are all possible experiences where PTSD may result. The sooner PTSD trauma survivors receive psychological help, the better they are likely to fare. As a result of the new therapies, including nonverbal engagement such as images, symbols, metaphors, drawings, writings, conscious breathing and movement, there's a lot of effort being put forward into PTSD as a result of a number of conflicts and military around the world that affect many other people who have attended to to the many soldiers that are affected. Now, next we'll consider obsessive compulsive disorder, or OCD. Now, this too is an anxiety-based but not depressed-based disorder, and unfortunately our text has this incorrect as well. This is a reoccurring idea or thought or image that they realize, at least initially, is senseless. The most common obsession are repetitive thoughts of violence, contamination, and doubt. Now, it's important to recognize obsessive, which are the reoccurring thoughts that you can't not think about. These are intrusive thoughts. Compulsions, well, these are the I don't know why I need to do this, but by doing it, I feel a little bit better. But if you don't, it all falls apart. Most people with OCD also suffer from compulsions. This is the repetitive behavior performed according to certain rules or in a certain stereotypical fashion. Now, if you were to witness someone experiencing OCD, you might see humor in it perhaps. However, there's no humor in it for the person experiencing it. In my abnormal psychology class, I post a video about Howie Mandel and his OCD and the impact that it's had on his life. Most people's responses to seeing the video is that they weren't aware, one, that he had OCD, or two, if they were aware, they weren't aware of how troubling and how hard it has been in his life with OCD. Individuals with OCD realize that their thoughts and their behaviors are bizarre. However, they cannot resist them and they cannot control them. OCD is believed to have biological roots. That is to say, there is some genetic or biology associated with OCD. It may be the result of genetic abnormalities, head injury, or even an autoimmune reaction after childhood infection with strep bacteria. Treatments may consist of cognitive therapy, behavior combinations, behavior techniques, and medications, or a combination of them. Now, what another disorder is that is in a category of under anxiety is adult attention deficit hyperactivity. It's a psychiatric diagnosis to describe individuals who may or may not have inattention behaviors. There are three types of ADHD: predominantly inattentive type, predominantly hyperactivity type, that's a hyperactivity impulsive type, and then third is combined type. Now, the causes of ADHD and ADD are complex, and they include between 40 and 70% of children with ADHD do not outgrow their condition. Children with ADHD may find it hard to concentrate, read, or make decisions, complete complex projects, or meet deadlines. My own experience, I was diagnosed with ADD when I was 42. Looking back at my childhood explains a lot about the difficulties that I had in school and the challenges that teachers had with me. It wasn't that I was predominantly hyperactive, it was that I was overly attentive to too many things. And that's the misnomer about ADD. It's not about not being able to pay attention, it's really just about not being able to discern between what I should pay attention to and what I find is I shouldn't pay or is extraneous. However, when you learn strategies, it enables you to access a more focused response to things. It just means you cope with things differently now. Less distracted, even more creative. Next, we'll look at bipolar disorder. It used to be characteristic, or it used to be known as manic depression. The characteristic symptoms of manic depression include mood swings, changes in thinking, changes in behavior, and changes in physical condition. During manic periods, the individual makes grandiose plans to take dangerous risks, Now, this doesn't mean jumping off the side of a building with parachutes. This just could be things like gambling. This could be a financial risk, investing all your savings. Now, bipolar 1 is a fluctuation between full mania and followed by lighter forms of mania. However, they may often plunge from this highest of highs into this horrible low of depression episodes. Bipolar 2 is a depressive state followed by a light manic episode or cycle. Some experience both depression and mania. This is known as mixed episode bipolar. Mood stabilizing medications are the main and most reliable of treatments, although psychotherapy plays a critical role in helping individuals understand his or her illness in order to rebuild his or her life. What's important to know about this and to bear in mind, people with bipolar will often fail to do is to take their medication, especially when they fall into their manic episodes. They think everything is going great, so they go off their medications until they're depressed. And then the cycle continues, primarily because there's no consistent application. Okay, now let's look at depressive disorders. Depression is the world's most common mental ailment. It affects the brain, the mind, the body in very complex ways. Approximately 8% of Canadian adults will experience major depression at some point in their lives. The onset of depression usually occurs around adolescence. It's mental health. Many mental health issues occur in late adolescence and early 20s, since this is when we start getting more pressures to perform. Now, whether it's to live independently or achieve, to do your own schooling, to get a job, it's these things that can stimulate some of the onsets for early mental health issues. Psychotherapy is remarkably effective for mild depression, and in some serious cases, antidepressant medication can lead to dramatic improvements. Exercise is also a good way to both prevent and treat psychological problems. Now, we can look at major depression. The simplest definition for major depression is sadness that does not end. The incidence of major depression has soared over the past 2 decades, especially among young adults. Some of the characteristics in terms of symptoms for major depression can include feeling depressed, sad, empty, discouraged, tearful, loss of interest or pleasure in things that were once enjoyed, eating more, eating less than usual, or either gaining or losing weight, having trouble sleeping or sleeping too much. You see, there's a dichotomous sort of perspective. It's either too much or too little, but it's problematic and it causes grief. Feeling slowed down or feeling restless and unable to sit still, or a lack of energy. Feeling helpless, hopeless, worthless, and inadequate. There are also some very significant physical symptoms like headaches, digestive problems, aches and pains. So we're seeing how major depression is majorly influencing the life of a person significantly. In most cases, of major depression can be treated successfully, usually with psychotherapy, medication, or both. Psychotherapy alone works in a more than about half of the mild to moderate episodes of depression. Patients treated for depression often will be taking antidepressant depression medication, so it's important that you know to be aware that these aren't the normal everyday versions of sadness that we probably experience pretty regularly. Research suggests that aerobic exercise, about 30 minutes, 3 to 5 times a week, has proven effective against mild to moderate depression. And this is good to know for individuals who cannot take antidepressant medication because of medical problems, or for those who do not improve with psychotherapy or drugs. There's another alternative. Electroconvulsive therapy it sounds dramatic, and it is. It's the administration of controlled electric currents through the electrodes attached to our scalp. It remains the safest and most effective treatment. It doesn't seem that it should be. It seems scary, but it's significantly effective, particularly with major depression when other options don't work. Okay, we can consider another one that you may or may not be familiar with: premenstrual issues, specifically the premenstrual syndrome, or PMS, and premenstrual dysphoric disorder, PMDD. They refer to a wide range of physical and emotional symptoms that affect a woman at about 5 to 11 days before she begins her monthly menstrual cycle. Physical symptoms include bloating of the abdomen, breast tenderness, headaches, fatigue, less tolerance for noise and lights. The emotional symptoms can include feelings of sadness, anxiety, poor self-image, or tension. Behavioral changes can include irritability, hostility, outbursts of anger towards others. Now, the exact cause of PMS and PMDD is not really known. A lot of psychological disorders don't always have known causes, and that makes treatment decisions very challenging. The next depressive disorder we'll touch on is what's known as seasonal affective disorder, or SAD. Compared to clinical depression, people with SAD experience some of the common symptoms of depression only during the fall and the winter season, when the sun is lower and we see less of it. Some research suggests that SAD might result from the shorter days, where exposure to sunlight is limited. Treatment for SAD includes light therapy, where you wear glasses that shine lights onto your eyes, or it's also known as phototherapy. Other treatments for SAD include antidepressant medication, counseling, and spending more time outdoors during the winter months. We will now review a really significant and much misunderstood psychological disorder, schizophrenia. The symptoms of schizophrenia, one of the most debilitating mental disorders, includes hallucinations, both the seeing and hearing things that aren't there, delusions, believing things that aren't true or real, and an inability to think in a logical manner. Talking and making odd and purposeless movements, and not moving at all in the same cases. That's also known as catatonic. Repeating others' words, or just mimicking other people's gestures, showing few, if any, feelings, and that's known as being a flat affect. Responding with inappropriate emotions, lacking a will or motivation to complete tasks, and functioning at a much lower level than they had in the past. Now, schizophrenia might be the result of the failure of brain development that occurs early in life. It has strong genetic basis. It's not the result of upbringing or uncaring parents. They don't cause schizophrenia. This was long held to be the cause for schizophrenia for many years, quite a while ago. It's not a result of upbringing or social conditions or traumatic experience. A comprehensive treatment program includes antipsychotic support and medication, education, family support, and integrated addictions programs. Now, we'll move to a difficult topic, and we'll move to this one now, and that is suicide. In this component of mental illness, while not a psychiatric disorder, does get classified in the DSM-5. Suicidal behavior is highly correlated with mental illness and can have tragic consequences on emotions and psychological problems. There is concern about Indigenous youth suicide. It's been occurring at higher rates in many locations around Canada. It's estimated to be 5 to 6 times higher than non-Indigenous youth. So what leads to suicide? Well, there's no conclusive answer or explanation for suicide. It's a constellation of influences. Many influence may combine in ways that lower an individual's threshold for vulnerability. Some specific factors believed to be linked to suicide, they can include more than 95% of those who commit suicide may have a mental disorder that could have been diagnosed or was undiagnosed. Many of those who commit suicide drank beforehand and use alcohol, which may lower their inhibitions. Drug abuse can also alter thinking and lower inhibitions against suicide. Hopelessness and helplessness may be the most common contributing factor. Suicide investigators have found abnormalities in brain chemistry of individuals who complete suicide, especially low levels of the metabolite of the neurotransmitter serotonin. If you're in nursing or have taken my psychology class, we look at the brain and biology, and serotonin is a very important neurotransmitter associated with mood. Another issue associated with suicide and issues associated with suicide and why it occurs is access to guns. Guns can add to the risk of suicide. Major life crisis can increase the risk of suicide. Long-standing intense conflicts with family members or other significant people may also add to the danger for some. All right, we looked at a few of the mental illness disorders. So some of the mental illness issues and psychological disorders. So where can one turn for help? If I need help as a student, your best source for identifying local services may be your college itself, the health unit, or your student services. There's counselors there, and what they can do is helpful, is useful, and they may help you right there in the office, or they may be able to redirect you to where you can get somewhere in your local community for some assistance and support as well. So that's one of the first things as a student that you can do. Your Education, Your Future is a guide to college and university students with psychiatric disabilities from the Canadian Mental Health Association. It focuses on particular aspects of college and university experiences and how students who are faced with mood disorders and mental illness can improve their level of self-care while studying at academic institutions. So there is at least a national and provincial directive to help students with mental health issues. Within the community, you may also find help through community mental health centers, local hospitals, psychiatric or psychological associations, or even your family doctor. Please just reach out to somebody. Now, there are more than one type of therapist, so let's consider some of the types of therapists. There are psychiatrists. They're licensed medical doctors, MDs, that are trained in various forms of psychotherapy and psychopharmacology, and they can prescribe medications. That's what makes a psychiatrist separate from, say, a psychologist or your family doctor. Psychologists have completed a university degree and require licensing, and they cannot prescribe medication. That is one of the differences between psychiatrists and psychologists. Psychoanalysts have taken special training in psychoanalysis. That's a Freud-based therapy, and it's not only therapy, it's not the only therapy out there. They assist clients in overcoming past trauma, and that's one of the major contributing components of Freud. He looked at the childhood experiences and how they might influence the adult experience. There are certifications and licensings that depend on the province for them. So for psychotherapists, marriage counselors, and other therapists, including pastoral counselors and social workers, stress management counselors, alcohol and drug counselors, they may or may not have licensing, but all need training and education. Some of the options for treatment: while the term psychotherapy refers to any type of counseling based on the exchange of words, guided imagery, or healing work in the context of unique relationships that develop between a mental health professional and the person seeking help. It's the talk therapy, essentially. Psychodynamic psychotherapy takes into account the role of early experiences and unconscious influences in actively shaping our behavior. This is all Freud-based. The psychodynamic treatments work toward a goal of providing greater insight into problems and bringing about behavioral change through those insights. This is, now this again, it's not the only therapy out there. Psychoneuroimmunology is a branch of medicine that acknowledges the integration between psychological factors and central nervous system in our immune system. This is regulated by our neuroendocrine system. They take much of the psychomedical background experience. Now, away from the medical, we can look at interpersonal therapy, or ITP, and it focuses on the relationship in order to deal with the unrecognized feelings and needs and improve the communication skills of individuals. Now, when we talk about interpersonal and focus on the relationship, it looks at our interpersonal relationships with our family, our friends, and our acquaintances, and how we can make those relationships an improvement. How can you improve your communication skills to bring about better mental health? Cognitive behavioral therapy, or CBT, focuses on inappropriate or inaccurate thoughts and beliefs. Things that we distort, if you will. They're irrational. It helps the individual break out of that distorted way of thinking and replacing it with more healthy ways of thinking. Those same issues, behavior therapy strives to substitute healthier ways of behaving for the maladaptive patterns that we used to use in the past. Psychiatric drug therapy uses psychiatric drugs that alter the brain's chemistry and relieves the psychiatric symptom. It is often used in conjunction with psychotherapy and is sometimes used as the primary treatment. It's important to note that with most treatments, there will be a partnership, and in many cases, with medication. It's rarely used by itself. Alternative mind-mood medicine, consumers are increasingly trying natural products such as herbs and enzymes that claim to have psychological effects. However, because they're not classified as drugs, they have not undergone the rigorous scientific testing required of psychiatric medications. Some medical professionals are concerned that little is known about the safety and the efficacy. That is, what do they do what they say they're going to do consistently? Health Canada has put a regulatory framework into place that now oversees these natural health products. And it's important to remember that natural does not necessarily mean risk-free. For example, St. John's wort, maybe you're familiar with that. St. John's wort has been used to treat anxiety and depression in Europe for many years. The possible side effects of the drug the possible side effects of the drug interaction, St. John's wort, should not be taken in combination with other prescription antidepressants. It becomes something that we need to seriously look at in terms of our treatment, in terms of what's best for you. Interview therapists, interviewing counselors, and it may be you should be doing that in order to be very careful about using non-licensed medications and non-licensed and non-clinically tested medications to deal with psychological disorders. So getting treatment from therapists, it's important to do your homework and feel free to interview somebody to see if their approach will fit with your needs. Okay, there we go. I hope this has been helpful. I wish you good luck and carry on with your work, everybody. We'll see you later, and next week, we'll see you there. Bye now.